There is a sentence I hear almost every week in my office. A new patient walks in, they sit down, they say some version of this. My doctor told me this is just my new normal. I have to learn to live with it. Stroke patients say it. PTSD patients say it. People recovering from long illness say it. People who went through medical detox and never quite come back say it. I want to show you what's possible when the answer to that sentence is no, it isn't your new normal. Your brain hasn't finished healing. It just isn't getting the right inputs. I'm going to walk you through one case in detail. A real patient, fully de-identified, but I want you to listen for the pattern because I see this pattern over and over again. If it sounds like you or someone you love, keep watching. Let me describe the patient first. Then I will show you one example of it. The pattern looks like this. Something big happens. Acute phase ends. The scan looks stable, and the person never fully comes back. The something big can be a lot of things. A stroke, a car accident, a bad infection, a medical detox, a trauma. The body survives acute event. The hospital does its job. The patient gets discharged. And then, months later, they're still not who they were. On paper, everything looks fine. Their MRI shows all damage but no acute findings. Their blood work is within normal limit. Their cardiologist or their neurologist or their psychiatrist tells them in basically the same words, this is your baseline now. Learn to live with it. But they know something is wrong. Their thinking is foggy. Their mood is flat or jagged. Their sleep is broken. Their energy is gone. The person looking back from the mirror isn't them. This is the pattern. And here's the part most specialists miss. The brain in its state isn't broken. It's stuck. It's stuck because we treated the acute event, but we never gave the brain the conditions it actually needs to finish healing. That's where this case comes in. I had a patient, a woman in her 50s, who walked into my office about 3 years ago carrying the full version of this pattern. He had been through 3 things stacked on top of each other. 1, a stroke. A couple of years before, it had affected her ability to find words or move on one side of her body. Particularly, she could not use her hands to draw. 2, a diagnosis of PTSD, severe non-standing, going back to events much earlier in her life. 3, what we call post-detoxification encephalopathy. That's a long word. Let me translate. She has gone through a medically supervised detox program. The program did what it was supposed to do, get her off the substance. But her brain didn't bounce back. After detox, her cognition was worse, not better. She couldn't think clearly. She couldn't regulate her emotion. She felt, in her own words, like the lights were on, but no one was home. 3 specialists had seen her by the time she came to me. A neurologist, a psychiatrist, an addiction medicine doctor. All 3 told her basically, this is where you are now, manage it. She was on multiple medications. She was barely functioning. She was honestly preparing herself to live the rest of her life as a diminished version of who she used to be. This is where I want you to pay attention, because what specialists missed in her case is what specialists miss in most of these cases. They were each looking at one piece of her. The neurologist looked at her stroke. The psychiatrist looked at her PTSD. The addiction doctor looked at her detox history. Nobody was looking at her as a whole person. That's a failure mode, and that's where the ACEs framework comes in. ACEs stands for 4 dimensions of a human being. every patient, every case, and every time. A represents anatomy, the structure, the brain tissue, the blood vessels, the organs, what the MRI sees. C, chemistry, the biochemistry, hormones, neurotransmitters, water, vitamins, minerals, fatty acids, all the nutrients and inflammation process, what the blood work sees if you order the right blood work. E, energy, the functional state of the system, how the brain is actually firing, what a quantitative EEG or brain map sees. Autonomic nerve system, the meridian system in classical Chinese medicine. S represents soul or spirit, meaning, trauma, identity, connection, faith. The dimension Western medicine has spent hundreds of years pretending it doesn't exist, and that every traditional medicine on earth has known is the foundation. Most specialists work in one of these dimensions. The neurologist lives in anatomy. The psychiatrist lives in part of chemistry and energy. The therapist lives in part of the spirit or soul. Nobody is integrating across all four. In this patient's case, here's what integration looked like. Anatomy, yes, there was old stroke damage. We weren't going to undo that. But there was healthy brain tissue around it that wasn't being recruited. Chemistry. When we ran the right panels, and we mean the panels most psychiatrists never order, we found significant nutrient deficiency, hormone imbalance, and elevated inflammation markers. Her brain was trying to heal in a chemically hostile environment. No amount of therapy was going to fix that until we fixed her chemistry. Energy, the qEEG, the brain map, showed that I had expected. The areas affected by stroke were under-firing. Other areas were over-firing to compensate. Her stress response was locked in the on position. Classical Chinese medicine would call this a profound imbalance of yin and yang, with stuck qi in specific channels. Western neuroscience and the Eastern medicine were describing the same thing, just in the different languages. Spirit, she had to carry the decades of unprocessed trauma. The PTSD diagnosis was real, but it was a label on a deep wound. Until we addressed meaning layer, who she was, what she had survived, and what she was here for, the rest of the work would only go so far. We didn't pick one of these to work on. We worked on all four at the same time. Targeted nutrient regulation and anti-inflammatory protocols on the chemical side. Acupuncture neurofeedback on the energy side, retaining the brain firing patterns directly. Trauma-focused psychoenergetic therapy and spiritual counseling, she would anchor in on the spiritual side. And the medication management of her stroke recovery and her metabolic conditions on the anatomic side. 4 dimensions, one coordinated plan. The brain is moving toward balance. She told me about 2 years in, I'm a better version of myself than I was before the stroke. The stroke might have been the thing that finally made me get well. I want you to sit with that for a second. 3 specialists told this woman her brain wasn't going to heal. Her brain wasn't broken. Her care was fragmented. When we treated her as a whole person, anatomy, chemistry, energy, soul, the brain did what brains are designed to do. It healed. I want to be careful here. I'm not promising this outcome to everyone. Every patient is different. Some damage is permanent. Some patterns are harder to move than others. But I will tell you this. In 30 years of practice, the patients I've seen recover the most are not ones with the mildest disease. They're the ones who got treated across all 4 dimensions. Anatomy alone isn't enough. Chemistry alone isn't enough. Talk therapy alone isn't enough. Spiritual work alone isn't enough. You need all 4, and you need them coordinated. If the pattern I described at the beginning of this video sounds like you or like someone you love, I want you to know that this is your new normal isn't always the right answer. Sometimes the right answer is that nobody has actually looked at all of you yet. If you are patients or family members exploring options, visit aceswell.com, subscribe for new case files every 2 weeks. Thank you for watching. I will see you in the next one.